Hello, everyone. Welcome to Science Med Whiz. Today we have a special guest. He's going to talk to us a little bit about more of the respiratory system and answer some of your guys' questions. Hello, Justyn.
Hello, everybody. Yes, I'm currently a pulmonary researcher working primarily on the anatomy and physiology of the respiratory system and the lungs.
We have two lungs that make up oxygen available to the body and remove gases like carbon dioxide. There are many conditions that affect the lungs. For example, can you please tell us?
Yeah, there's a multitude of conditions. Anything that deals with breathing, shortness of breath. Obviously, a very common and harmful issue with your lungs is that when you inhale smoke, such as from cigarettes, cigars, anything of that nature, you do permanent, irreversible damage to your lungs, and it's one of the most leading causes of death in America is lung cancer.
Perfect. Can you tell us a little bit more about the lungs and the right lung and the left lung?
Yeah, of course. So, the major distinction between the right and left here, which I'll highlight on the screen, is you have the right lung here, which is actually divisible into three separate portions. You have the superior, the middle, and the inferior part of the lungs. The middle, of course, being the smaller portion of the three. And then, if you want to move on to the left lung here, the only distinct difference you'll really notice is that you actually have two separate lobes of it, inferior and superior. The reasoning behind this is very simple. There's not enough space because right behind it you do have your heart. So if it was any bigger, it might
Yes,
actually impede your cardiac function.
correct. Yes. Your lungs make up oxygen available to the body and removing gases such as carbon dioxide from the body. How long does this process usually take?
So depending on your cardiovascular and pulmonary function and health, it can vary. There's a quite large range. So people in a more active exercise, they take care of themselves. They do a lot of exercise, especially cardio aerobics. You'll see around every minute they'll have around 12 maybe inhalation, respirations, entire things. So people with less, less cardiovascular health and pulmonary function, it will take about 20 breaths a minute actually. So it's quite a stark difference between
Very
the two.
different.
Yeah.
Correct. Yeah. So your respiratory system prevents harmful substances from entering your lungs. Can you give us some examples about this?
Yeah, so the primary example, especially if you want to zoom in on where inhalation actually occurs, so you either breathe through your mouth or your nose, and your nose, the nose hair that people commonly associate and they like actually is very important for your entire respiratory system. It's basically think of it as the primary defense, the first defense of when things try to enter your respiratory system. It acts as a barrier for particles such as dust, macrophages such as bacterium, and not only that, it can prevent things from getting deeper into your lungs that can cause more serious issues such as like walking pneumonia, for that example.
Sure. So one student asked, "What is cilia, and what is important about cilia?"
So cilia, like as I mentioned, they're small hairs, but they're more into your respiratory system than your nose. They're less superficial. So as you go down the respiratory tract, you're going to encounter these little hairs that line it, the interior lining of it, called cilia. Think about it as the cleaners of the respiratory system. When things start going through your respiratory system, such as macrophages, viruses such as COVID-19, things like that, these cilia will try to actually stop them and try to grab them. Like I was saying earlier about smoking, one of the primary issues with smokers is that once you inhale that smoke, it actually damages your cilia, basically giving viruses, bacteria, dust, anything foreign to your body a straight shot to your bronchioles and ultimately your lungs.
Correct. So some students have sent me some questions. Actually, no, some interesting facts that I'm going to tell you about, so you can give me some insight. So you can have lobes of your lungs removed and live. You can even live without one lung.
Yes, that's very true. You only do need one functioning lung. The issue, obviously, with that being is will have an immune compromised system. It would be easier for you to get infection because you only have one lung, basically one thing to defend yourself from the outside world when you breathe in. Many people actually in the past have lived with only a singular lung and have lived long, happy lives with it.
Yeah, and another student told me the lungs are the only organ in your body that can float. Well, what do you think about that?
Yeah, it's absolutely true. If you think about it, nothing anchors the lungs in place. They're just there connected to your trachea, which ultimately leads to your mouth and your nose. So it's actually not anchored in place, such as your heart with a brachiophalmic trunk that anchors it, or your brain, which is anchored by your brainstem.
Yeah, so the typical adult has 300 million to 500 million alveoli.
Yeah,
Can you show us that in the 3D model?
yeah, of course. I'll try my best to show it. It's going to be a little bit difficult again here. But so basically, with the 300 to 500 million number, it's just a rough estimate. Obviously, everybody is different when it comes to this regard. And not only is everybody different, it varies among adults. Like I said earlier, when you do smoke, a lot of smokers, they will actually permanently damage their lungs, and this is including into the alveoli. So that 300 million number, that's more around where you get for somebody in worse health. You get that 300 million number, especially for people that are chronic smokers, bad health overall, don't exercise very frequently. And then on the upper range, that 500 million, you're going to get that from people that do a lot of cardiovascular exercise, take very good care of themselves, haven't smoked, things like that.
Yeah, so also the diaphragm. I know we don't have it here in our 3D model. So what do you think about the diaphragm in this today in the
Yeah,
video?
so I mean, the diaphragm is basically where your lungs rest in the body. It's a very central location of your body. It just rests on top of it, basically. If you want to think about it, if you're laying on your back, that's where they would rest on, would be your diaphragm.
Yeah, so I know that the healthy lungs are pinkish grayish in color, and you probably see them in photographs and compare lungs of people who smoke to the lungs who don't, right? So, can you tell us a little bit about the typical lung in a human adult and the weight of the lungs?
Yeah, sure. I can tell you about, basically normal lungs, like I said, they're going to be pinkish, grayish in color. To a smoker's lung, which we've all seen pictures, they're going to be black. Obviously, less inflated, they're going to be damaged, a lot of scar tissue, things around that nature. A typical human lung weighs about 2 pounds, and so between both of them, it's going to weigh about 4 pounds even. And not only that is when you breathe normally, your lungs expand to about 10.5 inches to when they're resting about 9 inches. So they'll actually expand about an inch and a half through an inhale.
Okay. So, what are some common conditions and disorders that affect your lungs? I know students were sending me emails about this, like to tell you what do some disorders.
Yeah, of course. So I mean, obviously the most common and those applicable ones in most people is asthma.
Asthma. Yes, I know some students were talking to me about asthma.
Yeah, asthma can be triggered by a multitude of things. It could be from anaphylactic shock, from an allergy of some sort. It can be triggered by, you can have exercise-induced asthma, especially doing like very intensive cardiovascular sports such as running, sprinting, things of that nature, even swimming.
So,
Um, so
yes.
yeah, and asthma is one of those things where it just basically means the airway is tightening. Even sometimes, to be honest, with the extreme cases of anxiety, you can actually experience asthma attacks.
Yes. Also, a student asked me about COVID-19. What do you think about that?
So the verdict's still kind of out on COVID-19. It definitely impacts your lungs. It's definitely the driving force as it goes into your lungs firstly.
Yeah.
I mean, it's different for everybody. It's like every other virus or
Yeah, it's like
disease,
yeah, just
so
like influenza and like lung cancer and stuff like that, and pulmonary and pneumonia.
yeah, and it's like I said, everything's different for everybody. You experience things in different ways, and especially when it comes to COVID-19, it's just another thing where some people will even develop things called long COVID, where people will have symptoms and even have live virus for years to come after they've been primarily infected.
Yeah, so in our next video, I want you to talk about more about the disease and disorders of respiratory and our respiratory system. And also, I also want also what are some tests usually that healthcare providers do?
Yeah, I mean, most of the tests you're going to go into is mostly oxygen saturation, how much that gas exchange in the alveolus is actually occurring. Basically, meaning how much usable oxygen is there for your tissues and organs. Another test, obviously much easier than that, is you would literally just listen. A lot of symptoms can be diagnosed early, especially with influenza. A very common sign is wheezing. Wheezing, shortness of breath, things of this nature. It almost would cause like a high pitched noise where you can tell that the airways are impeded in some fashion. So
Yeah.
it's very simple testing that you can do for a lot of illnesses. Obviously more advanced things such as lung cancer would, you'd have to get much more, diagnosis to figure that out.
So yeah, so in our next video, we're going to talk more about that, and we're also going to talk about the medications and also the surgeries that are needed for these diseases. And what can I do to keep my lungs healthy? Can you please tell us for the students?
Yeah, I mean, primary thing you want to do is just stay in good health and exercise. That's what it comes down to. Definitely avoid vaping and smoking and all these other trends. They have long-term side effects and definitely are not a good trend to get hopped on here. A big thing also is, take care of your body, especially when it comes to weight reduction. I know it's a controversial thing to talk about, but when you are, have extra weight on, it does impede your lungs from expanding properly, and that can affect have shortness of breath and develop things such as asthma just from things like that. I mean, there's a whole thing when everything's affecting your body, it affects your lungs as well.
Yes. So, any other suggestions and questions that you students have, please email me, and I will also ask Justyn for for some insight about these questions. Justyn, do you have anything else to say to our students?
No, that's about it. Take care of your body, and I'll see you guys in the next episode.
All right, have a good one, everyone.